Hello, good evening, everyone, and welcome to our bariatric support group. My name is Sean Leask. I am the bariatric program coordinator and registered dietitian at the Presbyterian location. I'm so excited that you're all here connecting virtually. Tonight we have a very special guest. So with that said, I'm going to introduce our guest for this evening, Dr. Gary Korus. He is our metabolic and bariatric program director at Presbyterian, and he might be your bariatric surgeon too. So with no further ado, Dr. Korus, welcome.
Thanks a lot, Sean. Thank you for the introduction. First, I want to welcome everyone that is on for the support group this evening. I have to tell you that I have missed these support groups probably as much as you do. Our support group typically at Presby met Saturday mornings, and I was typically around anyway, and I really enjoyed kind of wandering through just to hear what people were asking, to see familiar faces. But it really was invigorating for me to see people that I have seen over the years, to see where they had come from, to see where they were, and more important, to see the camaraderie amongst the entire group. And I've got to tell you that I miss that. So I'm sure if I miss that from my side, I can just imagine what a challenge it is for all of you over these past few months. I get to see kind of snapshots in the office and then when you're in the hospital, although that has become such a short period of time, I feel in some ways that I'm robbed from really getting to know you as much as we had in the past. But I think the point of this and what we're hoping that this will build is to build that type of a relationship and in a selfish way for us as well as for you. I know that I get more out of it the more times that I connect with each of you. And I'm sure that that is true for you as well. These are challenging times, you know, with the holidays this week, with Thanksgiving coming up and the holidays coming up around the new year. I think that these were support groups that people really looked forward to. They looked forward to the opportunity to connect, not just to see what other people were doing, but it gave them a chance to kind of reflect on their own situation, to see where they had started, to see where they had come from, but also an opportunity to really take inventory of certainly the medical side of it, but really their lives in general. And we see how important health, certainly weight as it plays a role in our health over the years, but really the way that we relate to our families, to our friends, what our hopes and wishes are for the future. And it's been a challenge. It really has been a challenge, and I'm encouraged that we're doing more of these now. We're still figuring it out, but I think that as time goes on, we're going to be able to provide the kind of support that we would like to, because we want you to succeed. We want you to have the best possible success, and that means reaching out. It means us taking the opportunity to reach out to you. But similarly, I want all of you to feel comfortable to reach back towards us. That's why we're here. We're here so that if you have questions, concerns, you feel comfortable, you know, certainly to join on a chat like this, or through the social media avenues that are out there, but even just to pick up the phone. That's why we're here. This is a lifelong process, and we are committed to being there to support you. So I just wanted to make that clear that, you know, it isn't whether you're coming in for your office visits or they're telemedicine, the lines of communication are open, and it's really there for you to benefit. But I have to say, in some ways, it gives us great satisfaction to be able to provide that support to you as well.
Mm-hmm. And I'm glad you mentioned that about missing our Saturday support groups, because I definitely miss them too. And I'm glad that we're doing this now. We had a great turnout for our Saturday support groups, and I know other groups did as well. So with that introduction, we've got a couple of questions already. First, we have some love for the bow tie. Love the bow tie, Doc, someone said. Thanks, Jay. Jay's also looking for a few ideas to help restart weight loss. You know, especially in pandemic, we talked about that. A little bit harder to jumpstart some weight loss.
Absolutely. And to be honest, this is a question that you should feel very comfortable asking, because it's not just our bariatric patients that are faced with this, but if you look at social media kind of across the board, you know, people talk about the COVID-19, with the 19 being the number of pounds that people have gained. I just saw some post, actually it was on one of the weekend magazine shows, just about snacking, and how snacking in the general community has increased so dramatically. And some of the recommendations that they had, I think, really pertain to all of us. We've become somewhat more sedentary. Some of it is out of need, and some of it is out of safety. But I think recognizing that is probably the most important thing. I think that realizing that there's nothing magic about, you know, New Year's or New Year's resolutions, or, you know, that it's time to, you know, Thanksgiving is a time for change. I think simply kind of going back to the basics is true for all of us. And it's not something that's going to change overnight. If you go back to when you started in the program, it was small steps in learning what you would need to do, learning about nutrition. You know, if you were one of my patients, you would certainly hear me before you were discharged talking about, okay, you know, what are your goals? 60 minutes a day of activity every day, break it up. But you had to start somewhere. Even in the office, you know, this week, we talk about having goals and starting small, but having goals, really starting out in a step-by-step fashion. You know, in the last week, we've seen the temperatures go up and down. So it really is sitting down, kind of reflecting on things you may have been doing and figuring out ways that you can start. If what I tell people is you have to have a plan. If it's 3 degrees out or 93 degrees out, you have to have a plan for what you can do. And again, it can be starting small, just simple activities around the house. You know, now going out, I would recommend anyone that's going out to make sure you maintain social distance, that you're wearing your mask, but you don't have to do 60 minutes every day starting tomorrow. It would be great, but that's probably not realistic. You do have the opportunity, because we have this holiday weekend coming up, to get into a pattern, perhaps with some fewer distractions of work. You may not have as many people at your Thanksgiving table. So there is a bit more time to take a few steps in a gradual way, so that over the next several days and few weeks, by the time you're, you know, facing the challenges of work again next week, you've already started to lay the groundwork for it. You're not going to conquer the world in one day, but all it takes is starting one day at a time, setting that time aside. And it's true for all of us.
No, that sounds great. And also talking about not waiting for New Year's or a new time, you know, just taking this opportunity and starting now and doing what you can. I think that's very reasonable for all of us. We got a question here about Cpap use after surgery. And I will mention that we're having a nurse practitioner from the sleep center coming to one of our future groups in December, but I'll go ahead and pose this question. So how long after surgery do I need my Cpap? And that was from Stephanie.
Okay, Stephanie, I think that's a great question. Everyone's individual, but, you know, I'll kind of give a general answer about Cpap. many people kind of look at CPAP, and I've heard the range of responses for patients that I ask, are you using your CPAP? Everything from, it's the best thing that I've ever had, you know, I've gotten great sleep, I don't have headaches anymore, to this thing is evil. I think that it would make a great doorstop. But the bottom line is that you really shouldn't look at it as an obstacle. The reason for it, the reason that we use it, is we know that our patients are at higher risk of having different sleep disturbances. And those are significant. Untreated sleep apnea has significant side effects. There's a higher risk of stroke. There's a higher risk of sudden death. There's a higher risk of causing strain on your heart that can cause really lifelong and potentially life-threatening problems. So it really gives us an opportunity to treat some of those things while you are losing weight. Ultimately, losing weight will help in most patients with the sleep apnea. So my short answer would be, I would expect you to use it for at least 6 months after surgery. Many of our patients will be reevaluated 6 months after surgery, but I do hear quite often that, the mask doesn't fit anymore, or the pressure seems too high. Again, the sleep study folks are there to help. You may need an adjustment of your mask. You may need the settings adjusted as well. But using it really until you reach the point where we can safely say that those risks have gone down significantly, I really think it makes sense. So in my mind, I would kind of keep that 6-month time frame kind of at the forefront. We used to say a year, but I think that we are getting people many more patients evaluated kind of at the 6-month mark.
Okay, so for anyone with a CPAP or BiPAP, just keep that in mind. We got to follow up. So we have a question from Jody. Jody is about 4.5 years out from surgery, COVID stress, life stress. She's just, it's been a tough year, and she's looking for ideas on how to stay mindful and deal with stress without resorting to food, particularly junk food.
Jody, again, I think that's a great question. And again, you could ask this question of any group of people. Probably the group is a little smaller now that the election is over. Well, I think the election is over. But the stress that we deal with, there are many different ways to do it. I don't want to harp on activity and exercise over and over again, but a lot of these questions really bring me back to that function, to activity and exercise. When you think about snacking as an escape or as a way to deal with stress, I think the first thing is to think about why you are reaching for that. Are you bored? Are you stressed? Are you using it as, someone used the phrase procrastinate escape. So a combination of procrastinating and escaping. And I think that once you can identify kind of why you're doing it, that makes it easier. But if it's unclear why you're doing it, I think we've all kind of worked on strategies to find different ways. So if you can at least recognize the behavior and then try to substitute a behavior that you think will help in that same situation, I think that's a great way to do it. And the exercise or activity is really a great way to do that. Try to avoid having things nearby as far as snacking for stress. That kind of forces you to get up, move around, and gives you some time to think about why you are doing that. The social aspect is also a very big part of it. That in many ways, we're kind of handcuffed because we don't have those same connections over the last several months that we may have otherwise. But I'd encourage you to reach out to, your support group buddies and pals that you may have sat next to, and reestablish that contact to see what other people are doing as well. But again, I think it comes back to having a plan. Jody, I think that recognizing that this is something that you're dealing with is certainly the first step.
And I would love to hear from this group too, if you have a great idea for a alternate coping strategy for stress. If you are someone who journals or exercises or listens to music, I would love to hear you in the chat. Just share that with this group. I think that you all are experts just like we are at this.
And feel free to say what song it is that you de-stress to.
Absolutely. Okay, so here's a great question from Christine. So Christine has had struggles with her weight for a long time, and she's in the process of pursuing surgery, but her husband is concerned about safety. He's known some people who had a rough time with bariatric surgery. So she says, Dr. Korus, do you have anything that can ease his mind?
Sure, Christine. The concern about your family and just having people that are interested in how you're doing can be a great tool for you to use for success. The fact that someone's worried about you to that degree is a great sign. Having them join on something like this, I was going to say years ago, but it's actually only months ago, we would encourage you to bring that person to support group so that they could, they could talk to me, they could hear what I had to say, but probably more important, they could look around the room at other people that look like you, sound like you, to hear what their experiences are as well. But what I would do is I'd encourage that person, whoever your significant other is, whoever has concerns, to share in the process with you. We're all more than happy to have other people join in. It's a little bit more difficult when people are doing their office visits remotely, but if everyone's at home doing the visits, by all means, they should join in. The fact of the matter is that this is a lifelong disease. And to look at you or to look at your family members, it becomes pretty easy to see that this is a lifelong disease, especially if someone has seen you struggle over the years, losing weight, gaining it back, losing weight, gaining it back, and been with you over the years. The opportunity to have an impact on something that is going to change your life can be very rewarding for them as well. And we can help share that information with that individual. And again, we're still kind of figuring out the best ways to do that without having live support groups. But I think that for factors that person is concerned about, I would encourage them to write it down, to try and verbalize it to you if they're comfortable with that. Then if not, certainly to share it with the team. We're certainly ready and willing to have those conversations because it changes everything. It changes your life, it changes the lives of those around you as well. But I wouldn't look at that as a negative. I would look at that as a very positive thing that someone cares so much that they want to make sure that this is giving you the best opportunity to succeed.
Mm-hmm. Absolutely. And also in the virtual support groups, it's a great opportunity to have a family or family member or friend sit in and listen and kind of get excited about this too. So we have a couple of nutrition and diet questions. Stephanie is asking, she's just starting her regular diet. She's anxious to get back to things like salads and nuts and fruit. So she wants to know, what's the scoop with that? When can she go back to those?
Well, first of all, it's a very small scoop. The timing for it, when we, as the lead in to surgery and stressing the importance of nutrients. You know, obviously we focus a lot on protein because protein has many benefits as far as wound healing, allowing people to be full and satisfied. But protein is not the be all and end all. Getting back to adding fiber to your diet, appropriate amount of carbohydrates just for your body's metabolism is important. A lot of it is kind of individual, just as far as food tolerances. And I think that this is where, again, Sean, I may rely on you a little bit for this, is the way that patients are progressing in order to monitor and make sure that you're meeting those goals in the short term, as well as making sure that you're taking your right vitamins and supplements. But the one thing that I did want to touch on is the question about getting back to things that you like. And I think that stressing that is certainly a goal. You know, we have had many patients who are foodies and love food, and coming down the bariatric pathway does not mean that you cannot or should not enjoy food. There are opportunities to get back to foods that you liked. You may find that your tastes have changed, but it is a process, and it is a gradual process, kind of reintroducing some of those things. Sean, do you want to add anything? I don't think that one size fits all.
Yeah, absolutely not. And we give you a diet manual as a guide, kind of a blueprint. But I'll always say, if you are following a particular type of plan, if there are certain foods that you don't like or foods that you really want to prioritize, the book is really just a guide. And that also goes with diet advancement. So your body does not know which day of the calendar it is. Oh, day 14, it's ready for this. So we really want to be thoughtful and listen to you and review any kind of records that you have and try to kind of tailor custom fit. As Dr. Korus said, you hear a lot about protein during bariatric surgery, but the role of fruits and vegetables and fiber and whole grains, it's all there. So I would say, as you advance, speak with your team, discuss the foods that you're seeking to reintroduce. But as a whole, around that week 7 or 8 mark, we'll start to introduce those items.
Right. And I just want to add something else, Sean. You know, we had talked a little bit about mindful eating. And I think that at that time, you know, week kind of 6 to 8 is often when people are getting back to work and to other activities. I think it's a good time to kind of circle back and remember how important mindful eating is. You may be starting to introduce things that you ate before, or different types of foods or consistencies. And the tendency is to think, well, you know, this was fine before, but now it's not. Or, you know, now I'm distracted because I'm doing the kids' algebra and I'm doing, you know, working from home. And I feel okay. I've recovered physically from the surgery, but here I am not quite sure where I'm going with the diet. So be kind to yourself. Remember to be mindful, kind of with each bite. Think about how you're chewing, what it tastes like, how it feels going down, and it is a process. So there's nothing magic that, as Sean said, that happens on a given date. It is a process, and just remember that as you're going forward.
I'm going to back up to what we said about alternate coping strategies for stress. I'm impressed by this group. Cheryl is a crocheter. It was passed down from her grandmother, and she says it's impossible to graze when her hands are busy. So I think that is awesome. Jalitza is sewing, and she said she loves
crocheting.
And she says she loves to sing. So really good things that take a lot of time and effort, but, you know, kind of make us feel joyful and happy. Many of our group members are walking too. Indoor walking, outdoor walking, things around the home. So all excellent coping strategies for stress.
I really like the creative tone to it. You know, certainly early on in the pandemic, the do-it-yourselfers and even people that weren't do-it-yourselfers were undertaking things at home, and that's why the Home Depots and the Lowe's were sold out even more than Walmart was as far as things off the shelf. So an opportunity kind of to do something with your hands is a great idea.
And as the holidays come around, it's a good opportunity to make things for people instead of buying things. So great. So I have a question here too from an anonymous attendee asking, he or she is 8 months out of surgery, wondering if still considered high risk if they had a COVID exposure. Anonymous says that they feel great otherwise, they're following CDC guidelines, but 8 months out of surgery, still considered high risk?
Sure. So anonymous, I think it depends on what you're referring to as far as high risk. It's interesting. We do know that people with at higher weights do have increased risk should they contract COVID-19. And we've seen that in the course of people's health as time goes on. So I think that it's interesting the way that you phrase that, because when our cases were being canceled because many people considered these cases elective, but there were a group of bariatric surgeons who nationally said, first of all, these are not elective cases, and secondly, these are the patients that we should be operating on, because the goal of surgery is to decrease their risk. And if we can do that with surgery and have people decrease their risk overall, then we're actually doing a much greater service for them than if we push their surgeries back. So for anonymous, if the thought was that you were high risk because of having COVID previously, or is the concern about possibly contracting it now?
The way I was interpreting this question, it seemed like it was contracting it now, just am I higher risk now that I'm post-surgery, but
okay,
several months out?
Let me answer it that way, that I certainly tell our patients, my patients, that having surgery, having a major surgery like this can suppress your immune system, but it's a fairly short-term effect. Really, we're talking about a couple of weeks' time. But beyond that, I would say that you should take the standard precautions at this time. I think that's all the more reason to make sure that you're getting adequate nutrition, that you're taking your vitamins. You know, I'll put a plug in for a follow-up. Making sure that you're keeping your appointments really gives you the best opportunity, not just to succeed with your weight loss, but really to minimize your risk as a member of the general population.
We have another question from Stephanie. She's wondering about stress eating, if it's something healthy. What do you think about that? If it's something healthy, is stress eating okay, or should I try to do something else?
So I have a hard time thinking of stress eating as really being anything good. I think of stress eating as a mechanism to deal with certain stimulation and input, looking for a way to deal with it. And I think that many of us, you know, have looked at food or patterns of eating as a way to deal with that. And hopefully, as we go through this process for our patients, we're helping you learn other techniques for dealing with this. Life's going to go on. It's COVID this year. It may be Aunt Nellie getting sick next year, but we're going to be faced with different stresses. And I think that developing more constructive ways of dealing with it will help you not just today and with this situation, but really for the rest of your life. So I think it's worth the investment of time and effort to find other mechanisms of dealing with it.
Mm-hmm. Yeah, and keep in mind too that your mechanism of coping may change and evolve over time. So maybe your crocheting is working now, and maybe in the spring it'll be outdoor walking. I mean, it's a dynamic process, and we are here to help you kind of brainstorm and think about alternates. Okay, great. Yeah, a lot of conversation in the chat about taste bud changes. I know that that's something that can be very interesting if you were someone who always liked one type of food and now your relationship is changing. So I'm interested to hear about that from the group. And we definitely have time for a couple more questions. I did see a question and I lost it in the box, but it was about, we're wondering about Thanksgiving, healthy Thanksgiving options. Very appropriate for this week.
So there are the obvious food questions, and I may, we actually had a conversation about, how many people actually like turkey or like the sides, and how much of that is just kind of the social aspect of what we expect out of Thanksgiving. What I would recommend, obviously, we're trying to encourage people to have their Thanksgivings with the people in their household. We can talk a little bit about a food, but I'd encourage people to make activity part of that as well. It is the holiday of giving thanks. Wherever we are in our pathway, to get outside for a little bit and walk around with the people that you're with, and to be thankful for being able to spend time with them, I think kind of puts everything in perspective. From an eating standpoint, I'll give you my nutshell, pardon the food analogy, I'll give you my brief view of that, and then can see what Sean thinks about adding on. I think that for those that are early in the process, I think planning ahead, thinking about foods that you enjoy and that you've tolerated well. Hopefully you are in your own home, but if you are somewhere else, it's okay to be prepared with things that work well for you, because you want it to be a pleasant experience. You don't want to be faced, with an intolerance or trying something that you haven't had before. So you want it to go smoothly. Again, some of it depends on how far along in the pathway you are. Even if you're pre-op, just to think about the types of things that you may be eating in the time ahead. If you want to kind of look at your plate and figure out what you're putting on your plate, again, that's going to be very individual as to what you've tolerated and what you like. It should be a pleasant experience.
Mm-hmm. Yes, and the planning, even the day of planning. There's a blog post that I just wrote that will be on our website, I think this week, and I always talk about scan and plan. So sometimes at holidays we tend to pass the dishes around and just scoop it on, almost like we're at a cafeteria. Really scan the options, pick the items that you're most interested in, and then build your plate that way. And Margaret Ann just commented, she said that she brings a child-sized plate when she goes to dinner. She said if you don't have a child-sized plate, a dessert plate will do. But really just kind of eating with our eyes and filling out a plate for a greater sense of satisfaction. Really great ideas. And Joan also commented that COVID has actually been kind of a hidden good thing for her. She's had time to be at home, control her food choices, and ease into new habits, drinking lots of liquids, finding new foods. So I think wrapping things up on that positive note is a good way to end. Dr. Korus, any other comments for the group?
Sure. I would really just wish everybody, not just we talked about the holidays and New Year. I'm glad to have the opportunity to kind of connect again with all of you, and that I'm glad to have that opportunity. And really, the message that I tell people that I like to share is we're here. Nothing gives us more satisfaction than to have you succeed. And whatever we can do to help you do that, sometimes the greatest challenge for you is to realize that this is a long-term process, and we're here to help. We may not have the answer right away. We may not have the answer is not going to be the same for everyone. But I'd ask you just to kind of reflect on where you've been and where you are, and really just wish everyone, a healthy holiday, and enjoy the time spent with your family and loved ones, and to be safe.